My name is Caitlin, and I am going to run through a quick neurological assessment with you. So it's just fairly precise. It's a focused assessment, and I'm going to start right away. So this is coming from a nursing perspective. It's a little bit different than if this was a CPR or an emergency situation. This is more of an acute care focused setting. So we're going to start first with the single most important aspect of doing a neurological assessment, and that is the level of consciousness. What is this person's level of consciousness? And an awesome way to remember, or even to begin your assessment, is the acronym Avpu. So I'm just going to write that up over here. I have a little piece of paper. So the acronym AVPU. The A stands for, are they alert? V stands for, are they verbally responsive? The P stands for, are they responding to pain? And the U stands for unresponsive. Okay, so Avpu, the first thing you're going to do basically is when you think of Avpu, you're going to divide it into two spots. So you're going to take this part of it and separate it from this part of it. Before you get to the PU, you're going to want to do this part because you may actually not have to do this part. So, are they alert? When you're coming in to see your patient, when you're coming in to do the neurological assessment, this is your first chance to lay eyes on them and determine, are they awake? Are they alert? Are they sitting there in their bed and their eyes are open and obviously they're alert? You walk in and their eyes are closed. What are you going to do? You're going to introduce yourself. Of course, you always introduce yourself, right? Hello, my name is Caitlin. I'm your nursing student today, or whatever it is your designation. You're going to say that to the patient. And then you're going to note, did they open their eyes? Are they verbally responsive? So before we go any further, you're going to be documenting everything, right? So you're going to make a note. Did they blink their eyes when you talked? Did they moan but didn't open their eyes? Or did they open their eyes and say, oh, hello, good morning, blah, 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 right? Next part. Obviously, we're always going to be doing our patient checks, especially in an acute care setting. We're always going to have to come in with documentation that has the patient's name and their date of birth, and you're going to bring that in with you, and you're going to compare it to another marker of who they are, just to confirm that you have the right person, right? This is definitely an integral part of nursing, right? So depending on the policy of the place you work at, that will determine how many checks you're going to do. So say we're doing 2 checks. We're going to find out, is this the right person? And if so, what's their date of birth? We want to make sure with that check too. This is also the perfect time to determine if they're orientated. So if your person is AV, they're alert and they're responsive to verbalization. Documenting how responsive. Are they talking to you now? If not, they're just kind of moaning when you talk. Well, then you're going to record that, right? And then we'll move on from there. But we're going to stop here and say that they woke up and now they're talking to us. So this is when we're going to check their orientation levels. Are they orientated to those 3 important spheres: person, location, and time? So when you're asking the person their name, and they're responding correctly and you're confirming with the documentation that you have, you've done that first check, and yes, they're orientated in this example. Second sphere, location. Where are you? Well, I'm on the 3rd floor of this hospital in this city. Perfect. Orientated times 2 spheres. The third, time. Now, not everybody has access to a clock or a watch or a cell phone, so just keep that in mind when you're asking this one. So you're going to say even a general question like, what day of the week is it? Or what's the date today? That will give you that orientation. Okay, moving on. They did not respond to your verbal stimulation. We're going to be moving on to the P. Pain. Are they responsive to pain? There's 2 ways to test this, really. You could use a finger pinch, or you can move on and use the trapeze pinch. Trapeze is the muscle, as you probably remember, that runs horizontal above the collarbone. You're going to apply with your pincher grasp, this one here, slight amount of pressure, increasing. As soon as they make a noise, you're going to stop, and then you can document that. But increasing over 10 seconds to be a little bit more painful. Not extreme, like you're not going to really hurt them, but you're just trying to get a stimulus. As soon as they make a stimulus, you're going to document that. Always, always, always important. Did they respond to the pain stimulus? Did they moan? Did they wake up? This has to be documented, so keep this in mind, of course. Okay, next, we're moving on. They didn't respond to the pain stimulus, didn't wake them up, they didn't move, they didn't flutter their eyes, they didn't give any signs that there was any level of consciousness there. The U. You can see the U there, okay, good. Are they unresponsive? So this is also at the point where you're going to be bringing in your coma scale check. So you may be using like the Glasgow coma scale, or you may have one that's in place that your place of work uses. So you'll find that information out, of course, you'll know that. And you will use that as a tool to assess their unresponsive levels. So it's usually a numerical tool from 1 to 15 or so that gives you a number. The lower the coma, and the higher the level of consciousness that they are at. So that is just the very beginning of the assessment. I will go further into more. I've already done another video that kind of encompassed everything, but I just really wanted to ensure that the Avpu portion of that video was a little bit more clear, because again, level of consciousness is the most important assessment of the neurological system's functioning.